Wren. About 350,000 uninsured Hoosiers will be eligible for health coverage starting Sunday. The federal government has approved Indiana's alternative plan to expanding Medicaid. It's being called the Healthy Indiana Plan, or HIP 2.0. Governor Mike Pence made the announcement Tuesday in front of a crowd of healthcare officials and political supporters.
Today, after 7 months of active negotiations with the federal government, I'm pleased to inform you that effective February 1, the Healthy Indiana Plan will be available to more Hoosiers than ever before. The state of Indiana has reached an agreement with the federal government on our Medicaid waiver. The Healthy Indiana Plan 2.0 has been approved.
Here's how the plan works. If you earn less than 138% of the federal poverty level, or about $33,000 per year for a family of 4, you can apply to HIP 2.0. Then, after you're accepted to the program, there are 3 plans you can enroll in. HIP Basic is a default plan for poorer Hoosiers that does not require participants to pay into a health savings account, but comes with fewer benefits and includes co-pays. HIP Plus requires participants to pay into a health savings account, but also comes with vision and dental, and for the most part does not include co-pays. And HIP Link gives low-income residents an option to receive assistance in purchasing private insurance through their employers. To explain more about who will pay for the health care expansion and what kind of reaction it's receiving, we're joined by State House reporter Brandon Smith, who was at this week's announcement. Hi, Brandon.
Hey, Joe.
Can you first explain why Indiana was seeking federal approval for HIP 2.0 in the first place? Why not just expand traditional Medicaid?
Well, Governor Pence has always said that any health care expansion had to be through what he calls a consumer-driven system. That's one that involves what he calls personal responsibility, having skin in the game when it comes to health care. And that's the real difference between HIP 2.0 and the traditional Medicaid expansion that other states have done through the Affordable Care Act. Here's what Pence had to say.
Healthy Indiana Plan 2.0 is a victory for the working poor in Indiana, hard-working Hoosiers who currently don't have access to coverage that they can afford. But also, HIP 2.0 is a victory for Medicaid reform, and I believe it could well become a model for states across the country.
So the governor is touting this as something the 19 other states that have chosen not to expand Medicaid could use as an example. But one of the main concerns many, including the governor, has was expanding coverage would cost the state money. Does HIP 2.0 resolve that concern?
It really does. First of all, the majority of the funding is going to come from the federal government. They're picking up a lot of the bill here. They pay 100% of the cost through the Affordable Care Act in the first 2 years, and then they'll gradually phase that down to where they're paying 90%. As for state funding, some of it will come from Indiana's cigarette tax, but the bulk of the state contribution will be from a new hospital assessment fee. Essentially, Indiana's hospitals are footing the bill here. But Indiana Hospital Association Vice President Brian Tabor says that's something they're willing to do because ensuring people get covered makes financial sense for them.
Last full year of data we have is $3 billion for Indiana hospitals in uncompensated care. So when patients are coming into the hospital without coverage, hospitals are providing that care and it goes unreimbursed, and the costs are passed along to all of us with private insurance, and just something that the hospitals have had to bear.
So the proposal seemed to have a lot of support in the people in the room, but they worked with him on the proposal. How about people outside of that circle?
Well, this is getting praise from just about every corner. Republicans and Democrats are obviously happy that so many more Hoosiers are going to be covered by this. And while Democrats have said that Pence should have just expanded traditional Medicaid last year, they see this as a good compromise. Federal Health and Human Services Secretary Sylvia Burwell said she's encouraged by the continued interest of governors in devising systems where they can expand Medicaid.
Okay, thank you very much, Brandon, from the Indiana State House.
Thank you, Joe.